This is Political Conversation. I'm Maury Thompson. Today we continue our discussion with U.S. Representative Chris Gibson, who will be talking about the House Republican budget plan. Now, I've also been talking about the budget and the coming budget, and there's a House Republican budget plan that's pretty comprehensive, but two of the aspects that have gotten a lot of attention are Medicare and Medicaid proposals. And critics of the Republican Medicare proposal to allow to have payments as opposed to an actual Medicare coverage by the federal government, they kind of compare this to like when a professional wrestling show comes to town and they advertise one set of wrestlers and then show up with a different set of wrestlers. What assurance can you give your critics that this won't be that situation?
Well, look, I've heard some critics say that our proposal kills Medicare. Look, it's not true. I mean, the status quo kills Medicare. You look at the CBO has done an assessment, and within 10 years, Medicare is going to go bankrupt. So what our proposal does is strengthen and preserve a critical program that, in conjunction with Social Security, which American people have come to embrace, since its inception in 1935, it's part of what it means to be an American. I mean, we pay into Social Security, for example, all throughout our lives, and then in the autumn of our lives, it's something we can count on. And the same with Medicare. We want to see that program continue and to be strengthened and preserved. And so, the first thing to know about the reform is that current senior citizens, there's no change. There's no change to their current program. For those 55 years and older, there is no change. For those 54 years and younger under our proposal, what we're talking about doing is actually expanding a program that's on the books now. Medicare Advantage, Medicare Part D, this is a program that's actually come under budget, that's popular in our district. And what we're talking about doing is providing future seniors the same set of options that members of Congress have. Right now, I mean, members of Congress can choose among about a half dozen different programs, and after they choose that program, then the federal government pays the premium to that insurance company, and they move forward. And so, this is, I think, a program that will provide choice to future seniors. It's a government-approved program, which was very important to me, that we didn't have a situation where an individual can end up being swindled, and we end up with a bailout program. And that's why I opposed the vouchers, because I don't want to see this thing privatized. It should be a government-approved program and a government-run program. So, look, there have been some analysis of the program, but I wonder how many people have actually taken the time to look at the proposal and to look at what the CBO said about it. I've read about it in great detail. On the front-end expenditures, what this program would do is, for future seniors, there would be about an $8,000 a year equivalent premium payment that comes from the United States government to the insurance company. Now, in addition to that premium payment, for those at the poverty line, or those 150% of the poverty line, there's a health savings account. Now, when you consider, for example, our district, anywhere from a third to 40% of those who are seniors in our district, they would qualify for a health savings account. That's $7,800 in addition to the $8,000 that future seniors would have as far as paying for the co-pays and the out-of-pocket pays. This is a good program. You say, well, how is that paid for? Well, it's partially paid for by those who are rich, those who are affluent. Those in the top 2% would not get the same program as those middle-class seniors or those working-class seniors. The top 2% would get about $3,500 in premium support, and those in the top 3 to 8% would get about $4,000 premium support. So this is a program that takes into full consideration where you are in life and in terms of your income, and also where you are in terms of your health. For those with chronic conditions, that would be accounted for in this proposal. So I think this is a good program for America that's going to strengthen and preserve a program that right now the CBO says is going to go bankrupt. And that's why I think it's a great starting point for discussion going forward. And again, that's the important thing to know about this. This is a budget framework with an idea, a concept on how we can strengthen and preserve a program that I think is fundamental. to Americans. You know, it's only been about 2 months when the talking heads in D.C. were all saying, I wonder if anybody's going to have the courage to tackle entitlement reform. Remember that? That was only a couple months ago.
Yes.
The president came forward with his budget, and he did not address it. And people said, well, I wonder if the Republicans will have the courage to do that which is necessary to address it. Well, we have. We've come forward with a proposal, and it's meant to start the discussion. And I think this is a good place to start the discussion.
Now, on the Medicaid side, the principle of the proposal is block grants to states, a set amount of money. States can design their own programs. The new state health commissioner was in town yesterday, and I asked him about the block grant ideas. And he said that Governor Cuomo feels that New York would wind up with less funding under this, and that it would be difficult to enact the reforms that they see as necessary in Medicaid. What's your thoughts about that?
Well, I looked at the transcripts of your interview with the commissioner, and it was curious to me that the comment is that the federal government is looking to save money, the state's looking to quality. Do I have that right?
Yes.
Okay, well, I guess my question would be is, what is it about a state-designed program that would not reach the quality of what the citizens of the state would want? I mean, that would be my fundamental question is, do you think that the state has the capacity to run its own program? I think yes. I think the state has the capacity to run that program. And in fact, one of the things that I have heard, actually two things that I have heard consistently across the 10 counties, the 137 towns, is that our citizens and our local officials are tired of the unfunded mandates. This is something they find very onerous. By the way, independent of party, Republicans, Democrats, Independents say that what they want to have is control of their budgets and of their destinies. And so what this proposal does is it essentially says is that the federal government's going to get out of the business of the unfunded mandates. The other thing I hear, and incidentally I hear it all throughout the 10 counties, is people are frustrated with the fraud, waste, and abuse in the Medicaid and the Medicare programs, both of these, the fraud, waste, and abuse. And what this program does is it allows the states to take control of their own destinies and their own definitions of eligibility and their own policing of this. So, look, I think that's the first order question here is do we think that states are in a position where they can run these programs? And if you think the answer is yes, then the question is, what's the appropriate level of a block grant? That's a discussion we can have. But the first thing I think we should decide is whether or not we think this is a program that can be administered at the state level. And I believe it can.
Thanks for watching. And watch later in the week for part 3 of our conversation with Chris Gibson. And if you missed part 1, you can view it on poststar.com. And you can keep up to date with all of the latest political news at the All Politics is Local blog on poststar.com. Or you can follow me on Twitter at ps_politics.